Hi there everyone, my name is Caitlin and I am the Improvement Facilitator for PACOP up in Queensland, and welcome back to our Clinical Bites series for care workers unpacking the symptom assessment scale. Today we are going to talk about distress around pain. So pain is a common symptom in palliative care. It can be present as a direct result of disease processes, for example in cancer, or can be the result of treatment such as radiation or surgery. Pain is a frequent complication of cancer, but it's also common in many other life-limiting illnesses. It's also important to take time and acknowledge that not all people with palliative care needs experience pain. Whilst it's very common, pain is not always a given when people are dying. However, we work in residential aged care and pain is more likely to be under-assessed among people living in an aged care home. And we know that pain, when it's not well controlled, causes significant distress and severely impacts the quality of someone's life, which is why in the symptom assessment scale, we look at the distress people experience around pain as one of the first things when we start that assessment. In our PACOP suite of tools, we use the symptom assessment scale to assess people's distress. We measure the amount of distress caused by 7 of the most common symptoms in palliative care, and we look at how bothered, worried or distressed residents are by each of those symptoms, and we do that to best manage what matters most to the resident. Because pain is subjective and not every resident will have pain, and those residents that do have pain may not necessarily be bothered by their pain. So we need to have a conversation to further explore pain and distress so we can care plan appropriately and support residents in a way that they want to be supported. And we do that by using some of the tools that you can see here on this slide to let residents know that their symptoms are important to us and that we want to know what bothers them most and that we want to do something about that. We can use the resident brochures, the SAS rulers and the SAS sheets to have a conversation and explore what's bothering and what's distressing a resident, and so we know what to feed back to our RNs and how urgent it may need to be. When we assess pain using the SAS, remember we are assessing how distressed someone has been over the past 24 hours. If you see a resident grimacing when they move, or when you are helping them in the shower or to the dining room, you may be able to use that opportunity to chat about how much that pain is bothering them and how that resident is actually feeling overall. If you don't know the resident all that well, you can ask a family member, a friend of the resident or a co-worker if how that resident is presenting is normal for them, or if the resident is looking different today. You can also proxy in these people if a resident cannot answer questions or if they find it difficult to articulate what they are feeling. Remember, residents may not associate what they feel with the word pain. They may describe this sensation as discomfort or achy or stiff or sore. If you are proxying in for a resident that cannot describe for themselves, observe the resident for any signs of pain, like appearing uncomfortable, groaning, grimacing, crying, or appearing agitated. And then use the SAS score guide that you can see here on this slide to rate what you see with a number. Now those numbers are associated with an action. If you have a resident that's reported 0 distress around their pain, no action is required. If you have a resident that's reporting mild distress around their pain, between 1 and 3, then report that to your RN supervisor within the shift. If you have a resident that's reporting moderate distress around pain, so 4 to 7, you need to be reporting that to your RN within 30 minutes of finding that information out. And if you have a resident that is reporting severe distress, so 8, 9 or 10, you need to be reporting that to your RN immediately. If you're also using Pain Check, we have incorporated and matched the Pain Check scores with the appropriate actions as well that you can see here on the slide. So finally, our take-home message for this quick little session is record, ruler and report. Record the SAS scores on the form system, use the ruler to determine the right action and report to your supervisor as per the ruler. Thanks so much for watching. This has been part of our Care Worker series for PACOP Clinical Bites. For more detailed information on all of our PACOP assessments, ask your PACOP lead at your aged care home or send us an email at pacop@uow.edu.au.